Hello, this is Dr. Gay from First Look MRI, and this is just a quick look at the flexor tendons of the ankle. If you don't see these often, it can be confusing. There's so many tendons around the ankle, but just to get oriented here, we're looking at an axial T1 weighted sequence. Here's the front, the back, here's Achilles. This is lateral. We can see the fibula, the peroneal tendons over here, and we're looking at these three now. So we have the posterior tibial, flexor digitorum, flexor hallucis tendons, these three tendons. And so if we go to the ankle joint, we see this area of darkness. If we go above it, this is called the supramalleolar portion. This is the tibia. And so if there's a tear up here, we say there's a tear of the supramalleolar portion of the whichever tendon. And this is called the juxtamalleolar portion here. And if we go down below, this is called the inframalleolar portion. So you can say there's a tear involving the juxta and inframalleolar portions of whichever tendon or tendinopathy. And the tendons can be torn, they can be enlarged, like we call hypertrophic tendinopathy or hypertrophic partial tear. They can be attenuated, but normal tendons look like this. They're uniform, very dark. The posterior tibial tendon is usually about twice as big as the other ones here. And again, to run over the anatomy, this is the posterior tibial tendon, flexor digitorum, and flexor hallucis. So we're going to start medial, and we're going to start up high. Here we go. This is the posterior tibial tendon. Again, about twice as big as the other ones. Coming down, nice and dark and uniform. Down now we're to the inframalleolar portion. It's coming down and it's going to attach here on the navicular bone. And at the attachment, it's going to split. Most of the fibers attach here on the navicular bone. And at the attachment, it can fan out and become bright right there. And I've seen some people call tears at the attachment, but really it's just because normal fanning out. So you got to be very, very careful to make sure it looks normal on all the other sequences. And clinically it fits, but you can see bright signal right at the attachment normally. You can see here some little bands coming off the medial side. This actually has a pretty big band here. Some of the fibers, most of them attach on the navicular, but fibers also branch off and attach to the cuneiforms here. But they're small and variable. I usually don't even mention those unless if this is normal up here. So this is the posterior tibial tendon. The next one here is the flexor digitorum, which is right here. And this goes down into the plantar aspect of the foot. You see right next to it is the flexor hallucis. This is going to go to all the toes. And this is the hallucis. This is going to go to the great toe. So you know these have to switch over. This has to go lateral to the second through fourth toes. This has to go to the great toe. So where they come across each other, right here, see how they switch sides here? Here's the flexor hallucis. This is called the knot of Henry. And sometimes you can get fluid accumulate there at the knot of Henry. And they have a common sheath where they come together. So we have the flexor digitorum, flexor hallucis coming together, crossing over at the knot of Henry in the plantar aspect of the foot. Continuing on, we have the flexor hallucis going to the great toe, and the flexor digitorum tendons here going to the other toes. So that is the quick anatomy of the flexor tendons of the ankle.